So let's get up to speed. So do you just want to start by saying what treatment have you had here with us at the dental suite?
I've had same day teeth, which is quite amazing anyway, to be fair. I think you can have teeth, my own top teeth took out, and then obviously the teeth put in temporary for 6-7 months while the sort of healed, the implants took and everything, and then Jamie fitted me teeth in I've got now, which was permanent teeth now, 3 weeks ago.
So in regards to before you had any treatment done, what were your teeth, what sort of condition were they in?
At all. I mean, I lost 3 of the front teeth anyway, and only got the 2 front teeth really. I've got about 10 teeth at the top, the segment, when you went to take them out, like, but they were falling out anyway, and I got gaps anyway, so they didn't look good, so I had to do something, so I deal with this one.
So how would you say that was affecting your sort of day-to-day life, and what was it that finally made you sort of seek?
Well, it's your confidence, isn't it? You don't feel, you can't smile really, as such, can you? Really, when you've got teeth like that, and I've got grandchildren. I'd like to have had, when I looked at the photos I got, I was always like to just a smirk, or sort of the hand over the mouth. It was never sort of a proper big smile like they were smiling like. So I thought, well, I've got to do something really.
And in regards to eating, was that affected or limited?
No, I could eat, to be fair. There wasn't a problem eating, but obviously it was just the fact how they actually looked. Not so much the eating, just the fact how they looked, and they weren't getting any better. They weren't going to get better unless I did something about it.
Yeah, no, absolutely. So, and how was it that you sort of stumbled across the dental suite?
The Evening Post, to be fair. I've been reading it for a couple of months, like reading, and kept thinking shallow or shanty, and in the end, I think I had a bridge, and I lost 2 where the bridge was attached, and so basically I lost another 2, so I had 3 missing at the top, and I thought, well, you might as well just come and do it. So I think January I come to see Kel, just basically told him what I've told you, that I just need to go to smile like properly, not feel embarrassed and everything, a bit more confident. And he basically said, yeah, we can do it, just tell me what you want. And I said to him, well, I don't really want to have false teeth, if you know what I mean. I know these false, but I don't want false teeth, and you always take out. And he says, no, what about same day teeth? Because I looked at that as well. And I said, yeah, can you do that? He said, yeah, we'll do that. And that was it. Went from there, and then had all the tests you have to go for, the x-rays and the molds and that. Basically, he did it, and I still can't believe you can do things like that.
So in regards to that first appointment, it was with Cal?
Yeah, here in January.
So how beneficial was that in terms of like a learning experience? If you like?
Yeah, it was brilliant. Really, he didn't push you to do anything. He just gave you the options. He said, these what we can do. Went through a list of things you can do. He says, and basically says, whatever you're comfortable with, he says, we can do for you.
So before that consultation, had you ever actually heard of something like same-day teeth, or even dental implants for that?
No, I heard about implants obviously, but not same-day teeth, where they basically take your teeth out and put your set of teeth in that you don't take back out. Because that, obviously, when they put them in, I think I went in March. That's how quick it was to prepare. There was in, and that was it. You didn't take them out again. Obviously, you had to be careful what you could eat, because obviously you've got to let the implants take into your bone. They're basically into your bone, and once after 6-7 months, you can basically take them out and put your proper ones in that I've got now.
So, for people watching, is it, just explain that same day experience. So just literally from the moment you walk in, what condition your mouth's in, and what do you leave with on the day?
Yeah, like completely different feature really. I walked in with my teeth and 8 o'clock, and walked out at 12:30 with permanent teeth in. Basically, it was unbelievable, yeah. And like I say, you went home, you could still eat. Obviously, you're restricted to what you can chew, so obviously anything like that. But yeah, it was fine. It was unbelievable. Just looking at them was brilliant. When you showed me in the mirror, you just put them in the mirror.
So obviously they're a temporary set of teeth, fundamentally, but also it's almost like having a trial smile, though, isn't it? Because if there's anything you're not happy with, that's sort of
yeah, that's where we were Jamie. Jamie just said, we'll have a look. He said, was you happy with how they were and everything like that? But these are slightly different. They're a much better fit, and they look a lot better than the temporary ones did. But the temporary ones were good, to be fair.
And in terms of the actual placing of the implants, well, first of all, did you have sedation?
Yeah.
Okay, so just explain what is sedation, and do you actually feel anything
Nothing.
going? Yeah.
No, nothing at all. It was amazing. Yeah, they were really good, professional as well when they do it. You know, they go through everything. The guy come out, the anaesthetist come out and explain everything he's going to do. You know, he was going to basically hold my hand all the way through it. Says if you feel anything, just move your thumb and we'll increase it or whatever. But to be fair, when I got in the chair and got comfortable, and he says, well, I'm just going to inject you. And that was it. The next time I remember was waking up with no teeth, basically. And then they brought me round. I went into the next room. Jamie come in, spoke to me, everything, fitted the temporary ones, and that was it, job done. I went home. That was it.
So, just to reiterate, a lot of people will think putting like.
Yeah, to be fair, I was quite worried, you know, because you think you have 10 teeth out in one go. You know what you like when you have one tooth out.
Yeah.
But no, 10 teeth straight out. You don't even know you haven't done. But to be fair, you just wake up and you're looking around thinking, what's going on?
And you've touched upon it, but obviously in terms of the look of your teeth, how you were involved in that process in terms of, so how closely did you work with Jamie in particular in regards to the sort of...
Yeah, he's always brilliant, Jamie. Yeah, really, I mean, the skill he's gone professionalism is unbelievable. It really is. You know, if you're worried about your teeth, come see Jamie. He'll sort you out. No problem with that. Yeah, and he asks you everything. He'll go through what colours. I mean, you could have like a celebrity white if you want, but you don't need a celebrity white. You just want a nice smile that's, you know, because you've got to match the rest of your teeth as well. So no, I mean, he basically does what you like. He'll do whatever you want.
And obviously now you had your temporaries in for a while, and now you've got your actual fix set for a couple of weeks.
3 weeks.
How's life changed for you then?
Oh, a lot better. It's brilliant now, and I can eat whatever I want now. You know, obviously he said we chomping on pieces of block and things like that. But he said no. He just says just eat as normal. But I mean, I think he'll tell you right from the very first appointment you come, especially Cal, where he'll say clean hygiene. It's all about hygiene. You know, you've got to keep on top of it, clean, brushing 2 or 3 times a day, use mouthwash, because at the end of the day, it's without that, no matter what they do, if you don't look after them, they'll go back. You'll end up with the same issue you've had before you even come see them. So we do that now all the time now.
And just finally, obviously you mentioned that you found yourself covering your mouth and things.
Yeah.
Have people around you noticed a difference in you?
Oh yeah, you can tell now. Well, you're more confident now when you talk to people. So you're quite happy to smile at them. And I mean, very rarely I don't put my hand across my mouth at all now. So yeah, it's a lot better. You're a lot more confident. And I just can't get over the fact how it's changed, how I feel about everything as well. You know, it's more you can talk to people. I'm quite happy now to have photographs with the kids. Brilliant now. Look well, just as good as they do now. Well, not quite.
Just finally, firstly, would you be happy to recommend a dental suite? And if someone's watching this video, how would you justify a significant investment like this in your teeth?
Well, I mean, it's your confidence. You've got to. I mean, I'll let you leave it to leave it. It doesn't matter how young you are. I mean, there's people who've had this same treatment I had in the early 20s. You know, so you're never too young or too old to have it. It's how you want to feel. If you feel confident, and you want to feel confident, and you're not happy with your teeth, just come to see it. Because I mean, they're very professional, from the girls in reception, you know, to the people who actually do the treatment to you. The outside people they're bringing, the anaesthetists and things like that, they're all professional and they're happy to do the job. Jamie, I mean, especially Jamie, he just seems, he wants to help you. If he can help you bring a smile to your face, then he'll do it, no matter what. So yeah, I'd recommend him any time of the day to, you know, and like I say, I know it's an investment, but they've got a plan, you can use a plan, you can do it 1 year, 5 years, it doesn't really matter. But at the end of the day, it's how you want to feel, isn't it? If you feel confident and you want to look happy and smile, then just it's a dental suite basically. I would anyway.